done. That means vacation, camps, and keeping a whirlwind schedule of activities. Dealing with a chronic condition like allergic asthma on top of all of it can be a challenge for kids and their caregivers. Let's talk about the symptoms and triggers with Dr. Stanley Goldstein and Mom Takesha, who has plenty of experience on this subject. Good morning to both of you.
Good morning.
Okay, I'm familiar with allergies and I'm familiar with asthma. So what is allergic asthma and how common is it in kids?
Well, asthma is a disease of the airways in the lungs that causes those airways to become narrowed or swollen, and then it results in the symptoms of cough, chest tightness, wheeze, difficulty in breathing. And allergic asthma, there is an allergen which is making those airways swollen and narrowed. Typical allergens are year-round allergens such as dust mite or animal dander. And allergic asthma is quite common in children. In the United States, there are 6.3 million children who have asthma. That's 1 in 12. And we know that the most common type of asthma is allergic asthma. In cases of children, 80% of children who have asthma have allergic asthma.
I think during the summer, our kids are doing a lot of different things. They might be doing day camps or be with different caregivers. So what can those caregivers do to help reduce their exposure to some of these triggers?
So most of these triggers are year-round allergens, indoor allergens such as dust mite, common in most homes in the United States. Dust mites get into pillows, carpeting, mattresses, upholstered furniture. So what can one do? Carpeting, which is a major reservoir for dust mites. If you can remove carpets, you'll decrease a large amount of dust mites. Dust-proof encasings on mattresses and pillows can also help decrease the amount of exposure to dust mite. Hot water washing of the bedding can also decrease the dust mite. It's the hot water that kills the dust mites. Changing from upholstered furniture to maybe a leather type or vinyl type of furniture where the dust mites don't get into the furniture. And then there are animal allergens. So if you have an animal at home, it's best not to have an animal. If you have allergic asthma secondary to animals, you can either, if you say, look, we can't get rid of this animal, you want to make sure that the animal is not getting into the bedroom. You want to remove carpeting, which is also a reservoir for animal allergen, or you can use air filters which clean the air of the animal allergen that's in the air.
Well, I think that's important to keep in mind too. Some of us might have family members that are coming to visit for the summer that might have kids with these kind of symptoms as well. What are the treatment options for allergic asthma?
So treatment of options for allergic asthma, besides what we already discussed, removing the allergens from the environment, medications. The most typical medication that are used are inhaled corticosteroids, commonly used by many many children who have asthma. But we know that medication does not always control the symptoms, does not always control the asthma, even though they're taking the medication. So we're here during the month of Allergy and Asthma Month with Novartis and Genentech to help educate both the healthcare providers, patients, and also the caregivers regarding allergic asthma and uncontrolled allergic asthma. So if you're taking your medications and you try to avoid the allergens, if you continue to have asthma symptoms, that's uncontrolled. Medication Xolair is indicated specifically for adults and children ages 6 and above who have moderate to severe persistent asthma, who continues to have uncontrolled symptoms despite taking their usual medication of inhaled corticosteroids, and has been shown that you do have allergies by either a skin test and/or a blood test indicating dust mite or animal allergy.
Takesha, you've been very patient, so thank you for waiting. Can you tell us quickly, we are short on time now, but a little bit about your child's experience and then your message for other parents?
Yeah, my message is really quickly. We did, my daughter Victoria has allergic asthma, and we did all the things Dr. Goldstein said. We, took care of all the things to get the triggers out of the home, but she was still having all the symptoms, the coughing, the wheezing, the uncontrolled. It was uncontrolled. We were doing all of the medication, taking our medications, and it was still uncontrolled. So we did what was simple. We made an appointment with our doctor. We had a simple conversation. She was uncontrolled, the medication wasn't working, and we started a new treatment plan. And that was the key, and that's why we're here today to talk about Asthma and Allergy Awareness Month, because we want other parents to go out and have that conversation.
Well, we hope you have an excellent summer as a family. Dr. Goldstein, where can our viewers go if they want more information?
They can get more information at the website Xolair, XOLAIR.com. And important to be aware of, just like we spoke about how Xolair can decrease asthma episodes, there's also the potential for a serious adverse effect known as anaphylaxis, which can be a life-threatening allergic reaction.
Important information for parents. Our thanks to both of you.
Thank you.
Thank you.
All right, the Morning Blend is back in less than 3 minutes. Stay with us.